Welcome back to Zen One Podcast. Today we're going to continue the trend of solo podcasting. And I just simply have so many things that I've learned from dental practice over the last couple of weeks. And I just couldn't wait to get it out and share with you guys. I shared some of the stuff, the three dental trends last week and today. My goal is to share with you the one thing that's missing in dentistry today. I want to preface by saying for all of us, it's a different thing. You know, I visit dental practice. I constantly see it. I see that it separates successful practices from not successful practices. And I really want to bring it up. Now, it's up to you if you think it is a big deal. Maybe you need to, maybe it's not one of the fires that you need to put out today, but it's one of those things that not urgent, but super important. Like it's one of those quadrants that long-term thinking, it's going to set your practice aside. And so, what is this one thing? So, when I go to see practices, I constantly get this question: how do I find better team? And I just can't believe that, or I would never believe that big companies or successful companies just got lucky by finding the right people. So that takes me back to this one thing of being training, right? So how do you onboard your team and how do you nurture your current team is a big deal. But here's the real trigger when it comes to the onboarding and training and properly um, evaluating the team. It's having the systems in place. My favorite question that I get all the time from dental practice is, it's usually, hey, Tiger, close the door, and then say, you know what? If I can find a really good dental assistant, that will make a big difference in my practice or in our practice. And I say, what is good? And more importantly, what is good to your practice? What would that look like? Right. And so that brings me to the point of having this system that helps you evaluate either current team members or the upcoming team members, somebody that you're hiring, creating this playing field for everybody, depending on their skills and personality traits, if they fit your specific practice. So, what do I mean by that? It's actually very interesting creating the levels. So, I last year I talked to my good friend Dr. Brian Stimler about this idea of tiered growth for dental assistant. So, not every dental assistant is the same. In creating this path of the tier growth for a dental assistant becomes really interesting. So just stick with me for a second. I'm giving you all this cool information, and these are the tiers, right? So let's start with sterilization tech, right? So basic level, somebody brand new comes in, and you set your own expectations for the sterilization tech, and you have the boxes that they need to check. Understanding the instruments, know small equipment and how it works. What do you call things internally, right? So that's a big deal. Montana Jack in one office could be something else in a different office. A dragon burr and something else. A beaver burr and something else. So knowing the slang or the terminology of the practice is going to be very important. And learn to listen and write things down. I think that's a good quality to have for a sterilization tech that will help you then train that person moving forward to the next level, right? And so, what is the next level? Aspiring dental assistant, somebody who can start turning over the rooms, helping the doctor, assisting the doctor on basic stuff, learning, standing there, watching over the shoulder of somebody who's the senior dental assistant, right? So, learn the procedures, learn the setups, be able to break down the rooms, HIPAA OSHA compliance, learn how to assist your doctor, learn to read the schedule, right? So, that's a big thing. Now, the next level is senior DA. So somebody who's been there, who understands things. And we're looking at clinical, leadership, communication things, right? So these three aspects are very important. And so learn to adjust removables, take x-rays, placing topical, learn to properly position or learn to proper position when assisting the doctor. Seat the patients. That's going to be super important, right? So from a especially communication standpoint, and that's where that personality test comes in, is you're going to see if that person is actually going to fit your practice. Some practices are overly bubbly when it comes to assist patients and sitting the patients, and some practices are not. And again, it's very different, and you got to know what you're looking for. And getting the wrong person into your practice might be also a problem. Take final impressions. So that's a senior DA. And then you will see there's a fork. right? So the next level of growth within the practice, which I've never seen before, but I think it's going to be pretty cool, is understanding who you have and the needs are, depending on if the person is a people person or more on a clinical. So let's talk about the clinical. I've seen a lot more of that. So let's just say you have a senior DA who's willing to go to the next level, right? To learn, get that leadership, get the position, and then what would that look like? So this is the person who would prepare for the day. They would have all the notes for the morning huddle. They will train the upcoming assistants. They will set the clinical standard. They will say, this is not how we do the things like that in our clinic, right? This is how we do it. This is how we set up the rooms. This is how we assist the doctors. This is what the doctor likes. They know all the things, all these little things that the doctor would like. Also, some of the other stuff like take series of x-rays without the doctor's confirmation, coach the upcoming dental assistants, and high-level surgical stuff in adjunct services. So again, this is more of a clinical track where if the doctor is going to go and take the implant course, she or he is going to take this assistant with them to the course so that they know how to assist, right? Now, hear me out. The second track, remember there was a fork, is the people person. So you probably have somebody in the office who are really, really good at people skills, right? Or at the people level. And they're the ones who come in and high five everybody. Morning huddle starts. They're like, I got this. And that's more of a management track. And I call it business admin track, where the person will be in charge of understanding supplies, ordering, and inventory control, manage communications between the departments, manage the back office personnel, manage the labs, manage equipment and repairs, manage nitrous and oxygen replacement tanks, an expert in practice management software. So as you can tell, this is more of a business track where the person is quote unquote manager of the back of the office, right? So less of the clinical, but both are very, very important. So it's really hard to ask somebody who's absolutely loves the clinical stuff to remember when to replace the nitrogen and oxygen tanks or check on the lab cases. And vice versa. There are some people that absolutely love calling the reps and the vendors and managing things. In clinical, they would hate to admit, but that's not their favorite thing. And we've seen this with doctors as well. So that's my recommendation when it comes to this. I'm going to test it out. But more importantly, I just wanted to put out there to see what you guys think. So creating levels and then the fork to split the business and the clinical actually creates a really nice dynamic in the back of the office, right? It creates the pipeline. It creates a clear path for somebody to go up. It creates some clarity on how much they're going to make, right? So because you can associate a range, the dollar amount per hour range within each level. And if anybody asks you $35 an hour, you're like, cool, let's sit down. Let's find out where your gaps are. Let's take the test. Let's do the assessment. Let's see where you fit within my structure of the practice. And if you're aspiring dental assistant, great. Maybe you're starting at $20 an hour, but you have a path to get to the next level. And we can train you. We can show you how to do that. So I'm really curious what you guys think, because that really brings the clarity into the office, clarity in the back of the office, and the clarity on the training, what we need to train at each individual level. There's going to be some overlap in the gaps, and clearly some sterilization techs would be learning how to look at the schedule to see what's upcoming. But I really wanted to share this, see what you think, and would you agree that it's missing in a dental practice, that basic training or understanding of the expectations of the practice, specifically of that practice? Again, I want to emphasize what works for that practice. And I always say, a lot of times we hear this, not every practice is the same. Every doctor wants to say we do things differently. And you will find out that most of the things, every practice is the same. But this is what really is different compared to any other practice, right? Your practice is going to be different, how you do the training, onboarding, and evaluating your personnel and your team members. And so if dental assistants are listening to this, I'm sure you're excited, because now this is, and I've talked to a few of you, that, oh my God, now that's going to be some clarity on how I can grow, how I can make more money, and how I can grow professionally. So I hope you guys like it. Let me know what you think. I'm really excited to see how this resonates with the dental practices. Thank you, guys.